Well, you're most welcome to today's talk. It's Wednesday, the 21st of April. Now, globally, cases and deaths, I'm afraid, are both climbing again. Let's look at a few graphics just to contextualize that to start off today. Cases going up globally. Now, we know the data is incomplete. We know some countries aren't reporting at all, but that is definitely an upward trend. And I've put a link into the latest World Health Organization bulletin, which is here. So what this shows is cases here. It's a bit of a complicated graphic. And they're colour-coded so we can see which parts of the world have what proportion of cases. So, for example, we can see that the proportion of cases here relating to Southeast Asia are increasing. And deaths is on this side here. And the death line, of course, the deaths given per region, you can't tell from this graph. But this is the line of deaths, and sadly we do see it going up. So we've had cases going up for quite a long period of time now, and deaths also starting to climb. So there's no question this is a worrying trend. And countries are particularly problematic. United Kingdom, India going up sharply. Now we've looked at this several times. We know that the cases in India are way more than officially reported because of the limited testing in many areas. So this graphic greatly underestimates the reality on the ground in India. Of course, we are concerned about India at the moment, but even on official numbers, it's going up. United States, the vaccines do seem to be working in the States. Canada, got a report from Canada tomorrow, so we won't mention too much about that. Brazil, France would be about here, but Turkey, unfortunately, going up really quite steeply. So that just gives a bit of context for various places in the world at the moment. Now, let's start off by confessing yesterday's errors. Yesterday, I said that it's all adults or all people over the age of 18 in the United States that are now eligible. Well, I've just taken this directly from the CDC website, and as you'll see, it's everyone over the age of 16 is now eligible. So apologies to people in the United States, but it is impressive. Anyone now in the United States over the age of 16 can just, everyone 16 years of age and older can just book a test. This is the envy of many places, not book a test, book a vaccine. What am I talking about? But booking a vaccine. I'm still waiting for my second one. It's been about 9 weeks now and I still haven't heard. So it really would be nice to get the second one done. So that's the situation in the States. That is good. Now, the issue in the States may become vaccine take-up fairly soon. If it does, when vaccine take-up becomes the limiting factor, then we'll start talking about it. Until then, I don't think it is the limiting factor. And I think more and more people are just waiting to get the vaccine, which is good news. Global increase in cases. So this is the latest publication from the WHO, which does collect very good information. Its forward thinking might be questionable, but its assimilation of what's happened is excellent. The data is there. So cases increasing for the past 8 weeks. Another 5.2 million cases just in the past 7 days alone. Deaths increasing, as we saw on the graphic, for the past 5 weeks. And there was 83,000 deaths in the past 7 days, up 7% on the last week. So these increasing cases and increasing deaths are not what we want to see. And as we saw, Southeast Asia, India, Western Pacific region are the areas of particular increase at the moment. Now, I know a lot of you kind of follow this story. How mandatory a vaccine is going to be? Well, I've got just a few examples here. United Arab Emirates, smallish population, but we've followed it in terms of its excellent vaccine rollout with Chinese Sinopharm and the Pfizer vaccine. At least one dose, 65% of the population, 2 doses, 38% of the population. So going well. But United Arab Emirates and Israel seem to be leading the way in considering restricting movements of the unvaccinated. So this is from the National Emergency Crisis and Disasters Management of the United Arab Emirates. Delaying or refraining from taking the vaccine will pose a threat to the safety of society. Pretty strong words. But it's hard to disagree with, as it poses a major challenge to the national efforts to recover. So pretty hard to disagree with that statement, really. Strict measures are being considered. Now, you can agree or disagree with that. but this is what they are reporting. Restrict the movement of unvaccinated individuals. Implement preventative measures such as restricting entry to some places and having access to some services. So what's going to happen here? Well, we don't really know, but a lot of countries are going to take this path. For the people that get vaccinated, really, why should they suffer for people that are not vaccinated? Once vaccine is universally available and rolled out, of course. It's a good question. We'll carry on discussing it. But whether you agree or not, this is what's starting to happen. Israel is another example. Some indoor venues, theatres and restaurants now require proof of vaccination or infection. And the countries that are sort of moving this way do seem to be reasonable. They're saying if people have been infected or they've been vaccinated. Now, I'm pretty sure it was Israel, I'm right in saying that you get a full green passport if you've had the disease and one dose of the vaccine. So having the disease counts as the first vaccine, which I think immunologically does make a fair degree of sense, the Israeli approach. Italy, this might surprise some people, national government decree, if a healthcare worker, hospital, so that's a healthcare worker in hospital, nursing home or other facilities, where they're in contact with patients, they have to be vaccinated. It's basically mandated. Then they have to accept, if they're not vaccinated, they have to accept a different work position without patients, or they can be basically sacked. So Israel taking a very strong line there. But again, looking at it from the other point of view, and we'll see an example of this later. Actually, if you are going into a healthcare facility, you want to know that you're safe. And surgeons, for example, have to be vaccinated against hepatitis B. Every one of my students in the first year was vaccinated against hepatitis B, 100 of them a year or whatever it was. This is just axiomatic. And really, why would the COVID vaccine be any different? You know, the idea of going to your healthcare provider and contracting HIV or hepatitis B or COVID-19 is something you really don't want. You know, patient safety has to be considered. So, interesting. Italy generally is introducing a green pass while waiting for the European Union health passport, which is coming. So if you want to travel around within the European Union, or you want to travel in or out of the European Union, although they haven't said this yet, but it's if you need to travel around within the European Union, it's inevitable. You're going to need it to fly in and out or drive in and out of the European Union. You're going to need this green passport. It's just going to happen, whether you like it or not. I don't see any alternative. It's the way things are going. Now, the bizarre story, Indian airline flight Delhi to Hong Kong, 4th of April. Just before we do that, this is the number of new cases in India, and basically it's not getting any better. So we're edging 300,000 official cases. Now, who would like to guess by what degree these are underestimated? Because these are people that have officially tested positive. So is this an underestimate of a half, a quarter? The real cases are much, much higher than this. But again, we see this very, very rapid increase in cases in India. And I am concerned. Now, getting back to this flight from Delhi to Hong Kong, 4th of April. Now, we don't know how many passengers are on this flight. The airline won't tell us, but the flight, the plane in question takes up to 188. All tested negative within 72 hours of departure. But when they got there, 53 tested positive, and that emerged during the mandatory 3-week quarantine in Hong Kong. Now, without that could have meant that Hong Kong had an outbreak of the new India variant. Now, how many of these were the new India variant, we don't know. We just know that 53 tested positive at some point during that 3-week quarantine. If you'd like to fly from India to England today, of course, you don't need to do a quarantine in a hotel, and you can just do it on your own, mixing with other members of family, going in and out, who go shopping, who go to school. It won't become hotel quarantine until 4 a.m. on Friday the 23rd. So it gives you a nice window of opportunity to get into the UK. I mean, why aren't these things done more proactively? Anyway, so just think about it. 53 cases. And we know that in India at the moment it's about 60% in some areas at least of the new India variant, which is looking more contagious, which is looking like it's causing more deaths, which is looking like it's causing some immune escape. Now, I'm not going to say more on that because we're not certain, but from what we're seeing in India, it would be pretty surprising if the pure science contradicts the epidemiology that we're seeing unfolding in India in front of our eyes, unfortunately. Now, also there's been positive cases picked up in Hong Kong from flights from Mumbai, and introduced an emergency 2-week ban on flights from India, Pakistan and the Philippines as well in Hong Kong. So Hong Kong doing a very good job of keeping the virus and perhaps more importantly at the moment the new variants out, whereas in the UK we are not doing such a good job. So still concerned about that India variant. I'm not going to go on about it until I've got more hard data, but it will be coming out in the next few days. Brazil's often also a bit of a concern. So the cases here we see, they're not far. That's the 100,000 line there. So new cases in Brazil, although going down slightly, still very high. And we know that the deaths in Brazil are high. So countries with particular difficulty there: India, Brazil, Turkey, that we know of. Right. Just briefly now, Johnson & Johnson vaccine, the Janssen Vaccine. European Medicines Agency met yesterday, confirms a positive risk-benefit analysis, so it's back on the menu, which is good to see. Lots of discussion about that. The actual papers from the European Medicines Agency themselves are that one. Concluded that a warning about unusual blood clots with low platelet count should be added to the product information. So they are accepting this link, albeit very rare. So it's excuse me, it's this combination. It's the unusual blood clots, particularly in the splanchnic system in the abdomen and the cerebral sinus veins. But when it's with the low platelets, when it's with the thrombocytopenia. So they are saying this link is there, but there's actually a pretty huge risk-benefit analysis. They're saying this should be listed as a very rare side effect of the vaccine. And this is based on 7 million vaccines in the US, and they've analysed 8 cases. Now, this is news to me. The last time I looked at it, it was 6.8 million vaccines, and there'd been 6 cases. And we know that all of these 6 cases were women, and we know that they're aged 18 to 48. So that's what we did know. This is fresh information that's come to light. Good to see that the CDC are publishing this, but as we look there's other side effects of other vaccines that do seem to be less publicised. Anyway, so the European Medicines Agency, 7 million vaccines in the United States, 8 cases. So we're dealing about what one complication here every 900,000 vaccines or so. So a very rare complication, not far off 1 in a million. All cases occurred in people under 60, so we can assume that there was a case. So given that the oldest before was 48, we can assume that a couple of these new ones were older, 1 or more were older. They all occurred within 3 weeks of vaccines. That hasn't changed, and the majority were women, so we can conclude that 1 or 2 of the extra ones were men as well, because the original 6 from the United States were all premenopausal women. Specific risk factors have not been confirmed, so quite why this is happening they don't know. But there is this rare condition. Plausible explanation, they say, an immune response similar to heparin-induced thrombocytopenia. So heparin is a drug, anticoagulant drug, and that can induce clotting and thrombocytopenia. It's called heparin-induced thrombocytopenia. So they say it's similar to that. And they're also saying it's similar to the rare side effects that have been identified with the Oxford AstraZeneca vaccine. But as we looked at before, all vaccines have potential side effects. So they are basically that's reinstated. And Johnson & Johnson itself actually suspended it originally, I think. But now that's back on for European Union countries. Of course, individual states will now have to act on that. United States is making an announcement on Friday, 2 days' time. But the risk-benefit analysis is so favourable, and that there are potential complications from all effective treatments. I'll certainly be getting my second dose as soon as I can, and indeed would have a dose of the without hesitation. I would have a dose of the Oxford AstraZeneca or the Janssen Johnson & Johnson vaccine as my second dose. It's just not on the protocol at the moment, but personally I wouldn't hesitate to have that. Studies are going on to work out about the likelihood of mix and match of vaccines, how efficacious that is. So basically, the European Medicines Agency are saying if any of these things happen, this is not for junior doctors to decide. It should be specialist haematologists and people that know about immunity and things like that. Senior doctors, very senior doctors should decide this, how to treat this. Because what the data from this... Now, the European Medicines Agency don't seem to mention this, but in the United States, they pointed out the importance of not giving heparin, which, of course, is the standard treatment for blood clots. So they pointed out it's very important not to give that. But the European Medicines Agency don't say what the treatment is. They just say basically kick it upstairs to senior doctors. So this is... It's not a treatment strategy that a junior doctor in A&E would decide. It would go to senior consultants, and rightly so until we know much more about it. They say to look out for shortness of breath, which could be blood clots in the lungs, chest pain, which could be blood clots near the pleural membranes or things affecting the heart, leg swelling, which could be blood clots in the major veins that drain the lower part of the body, persistent abdominal pain, which could be the splanchnic, the portal venous thrombosis that we looked at a few days ago. Neurological symptoms such as severe or persistent headache or blurred vision, that could be the cerebral sinus venous effects, and tiny spots under the skin. We call these petechial hemorrhages. Beyond the site of the injection, tiny blood clots under the skin. So basically, when you get little bits of bleeding under the skin, that's what they want you to look out for. Now, this is actually just quite similar to, you can actually get, couldn't see that, let me pull it up a bit, there you go. You can actually get, I mean, I'm not saying this is in any way at all related to meningitis, but if someone's got meningococcal sepsis, well, you can. It's the bacteria that causes meningitis, the meningococcus. It can cause meningitis, or it can cause sepsis, or it can cause both. But what it does is it damages the small blood vessels, and you get blood leaking out into the tissues. And it's hard to tell sometimes whether that's a rash or whether it's blood. So what you do is you get a glass, a see-through glass, and you press it. I haven't got one I would show you, but I could do it with my glasses maybe. Basically what you do is if you've got a rash there, then you press a glass on it like that. Yeah, that's working. Now, can you see when I've pressed there, through my glasses there, can you see my skin's gone white underneath? I think you can just about see that. So my skin's gone white underneath. That's called blanching. So rashes will blanch, normal rashes will blanch. Yeah, you can see the skin blanching there, look, with the pressure. So normal rashes will blanch, but if there's blood in the tissues, you won't blanch, and it will still look like the same rash when it's under pressure like that. And it would be the same with these petechial hemorrhages. If they stay obvious under pressure, that would be one indication that it's blood in the tissues. They don't mention that, I just thought I'd add that. So, but the official guidelines is tiny blood clots under the skin, not related to the injection site. So, good news that that's back on. The Janssen vaccine, of course, has got massive implications for the world. Stored at fridge temperatures, only one dose. You know, people that it's hard to get in for 2 doses, they'll just 1 dose of that. And it's a single dose vaccine, and it's relatively cheap as well. So, good news. I think good news that that's back on. Now, Carla and Roger have sent me an interesting report in. So it does 2 things really. It shows some interesting principles that we'll talk about, but it's also people's experience in this pandemic, and that's one thing we've always been interested in on this channel. It's all very well looking at the big global picture and the numbers, but you know, the human beings behind those numbers. And this is an excellent talk, excellent video. Not sure about the guy in the back, but apart from that, it is really good. So, Carla, Roger, thank you very much.
Hi from Miami. I am Carla. I am 54 years old. I'm 53, my kids keep telling me. I'm 53 years old. This is my boyfriend, Roger. He is 39 years old. He is very healthy. I have COVID. So does he. Now, I was very surprised to find this out. I've been watching you for over a year. I've been following all your advice on vitamin D, on vaccination, and proper hygiene. And starting January last year, I was already wearing face covering. This is from January because of you. And because of you, I consulted with my physician, as everybody should, if they're going to take a vitamin D supplementation. My physician recommended 10,000 units, 5,000 in the morning, 5,000 in the evening. But you must consult with your physician before taking any medications. And I've been taking, my levels were very low, like 25 at the start. Currently, they're 68. And I've been socially isolating. Roger and we live in the same household. We have the same diet. We pretty much don't leave the house. And when we do, and we just started leaving the house since December, maybe going, outside, going to, eat or something, but always outdoors and being very, very careful. So I'm very surprised that I have this diagnosis. I am going to tell you that I did take the vaccine on March 19th of this year. I took the Pfizer, the first dose. Then on April 9th, I took my second dose. And the same day that I got the vaccine, which I got it in the morning, I was going to make sourdough bread. I was very, very tired. I couldn't believe it. I'm like, oh my gosh, the second dose really hit me hard. And no, didn't think anything of it. The next day, body aches, everything. No fever, just body aches, no headaches, nothing like that. Roger had started for a little bit on Saturday. This was a Friday. On Sunday, more so Sunday night, having symptoms like fever, stuffiness, body aches, and by Sunday I was already feeling better. But the reason for me finding out that I had and being tested for COVID was that I have some stomach issues that have been going on for about a year, and they have not gone away. And my doctor suggested I go visit the emergency room. So we both went, and the doctors recommended that I have a CAT scan of my abdomen. But before they took me in, they said, you got to be tested for COVID. And I'm like, COVID? I just took my second dose. They're like, if you're admitted, you must have a COVID test. I'm like, okay. So they did it. By the time I came back from CAT scan, the two nurses came in, they're like, you have COVID. I'm like, no, I don't. Yes, I did. So they went through everything. They said my symptoms could be related to COVID, the stomach. I'm like, no, this is something from a long time ago. But other than that, I don't have any other symptoms of COVID. So they said that there's this monoclonal therapy that they are prescribing to individuals who have severe respiratory, as I do. I have acute bronchitis and asthma, and when I get it, I usually have to be hospitalized or have a lot of therapies, including steroids, for me not to become so sick. And I'm usually sick for anywhere from 2 to 4 weeks. Skipping through that, I, just said to my doctor, why did I get this? And he goes, well, you got it because you're probably not fully vaccinated. For some reason, you got it, and so did Roger. Roger has chosen not to be vaccinated. He's healthy, he's okay, we have proper diet, we follow all procedures, but he has had horrible symptoms. I mean, he has a fever now for 9 days. This is the first day that his fever is under 100 Fahrenheit. And I, for the first couple days, I was, just not feeling well, a little bit of respiratory problems. We have our oximeter and our blood oxygenation has been okay, but Roger has constant fever. One night he had pain in his upper thighs. They were so bad that actually kept him up at night. And then the next day, we belong to this concierge health service where we don't go to anywhere to get tested, or even our vaccines were brought home to us. And the doctor recommended this infusion with vitamins and a shot of 50,000 units of vitamin D. We did that yesterday, and he's already shown an improvement on his symptoms, including the fever being lower, right? Feeling much better. And I have no symptoms whatsoever of COVID. Actually, he has no sense of smell. I'm like, I couldn't deal with that. I love to cook. It's my passion. And I'm like, no, I can't. But I'm writing this because I feel compelled to tell your viewers that the vaccination is very important. And especially if you have other underlying issues, other chronic illness, we can't tell what the symptoms are going to be and how are you going to react. But I can tell you for sure, 100%, because of my experience of my whole lifetime. I mean, since I'm 3 years old, I've been treated for asthma and for bronchitis, and I even had one time I had swine flu. So and that was horrible. I thought I was going to die. Much worse than this now. But I am going to tell you, vaccine did help me. Roger didn't take. He is much younger than me. I assume much better shape. And he has all these symptoms not being vaccinated. So I'm doing this video to let you know and also I want to tell you what the doctor has prescribed us. Roger takes acetaminophen every 6 to 8 hours. We are also on the Z-Pack, myself especially because of bronchitis. Vitamin D, 10,000 units continued, plus we have the 50,000 shot. And now the doctor has included a daily baby aspirin. And he's doing that because of the risk of clotting from some studies with some of the vaccines. He's just trying to be proactive and prevent something from happening with me being vaccinated, or even just from COVID. Blood clots are usual. So I am happy to share this video with you. And I do have a question, very important one, and another subject. Roger just did this record of Jimmy Campbell. He's from England. And we were wondering, are you related to Jimmy Campbell, the musician? He was around the 60s, I guess, right? With Liverpool. I don't know. Just hi from Miami.
The question's easy. No, we're not related. My brother, who died a few years ago, 3 years ago, with motor neuron disease, he was a brilliant musician, but I just can't even clap in time. But no, we're not related to a Jimmy Campbell as far as we know. Although I think he was quite, Jimmy was on the go in the 70s, so it's kind of the right kind of time frame. But no, I'm not related. I will listen to him and see what I think. Anyway, seriously, Carla, I'm basically, with your comorbidities, I'm just so pleased you'd had 2 doses of the vaccine, because without it, really, you could have been really quite poorly. So I'm just so pleased that you had that immunological protection there. And Roger at 39, quite severe disease, quite ill. Glad to see you're improving now. Also glad to see that Carla went to her own doctor and he prescribed quite a large dose of vitamin D, it has to be said. But again, that may well have helped you in your acute episode. So quite a few things to learn from that, and very clearly and very well explained. So remember, don't take any medical advice from me or Carla for you. Go to your own healthcare provider and get that. But some very interesting general principles there. And of course, just the human experience of that. So I really appreciate you both sharing that, and I'm sure many people do as well. So thank you very much. So that is us for today. Thank you for watching.